Hello guys, welcome and welcome to Metier International Academy, one of the leading academy in training nurses in nursing competitive exam as well as IELTS and NCLEX and OIT training. Welcome back to Magic Pill session. As you all know that today we are going to discuss very important topic because each and every session we are discussing very important topics, and today we are going to start with cardiac biomarkers. So far, whatever the MCQs which is asked related to cardiac biomarkers is based upon the four important concepts, and that four important concepts we are going to discuss in detail today. So watch the video till the end. Definitely it is going to be so much useful for you. So let's begin the session. So as usual, today the session is going to start with the thought of the day. So the thought is never stop working for your vision, because you never know when your early morning struggle will turn into a overnight success. Okay, so never ever stop your trying process. Keep on trying for your success. Definitely one day your struggle will give success. Okay, so with this thought, let's start the session. As I mentioned already, cardiac biomarkers and the MCQs which is related to cardiac biomarkers, as I mentioned, four concepts. So what are the four concepts which is related to cardiac biomarkers? If you know this four concept, definitely one question is going to be come from this four concept which is related to the cardiac biomarker. So let's see what are the four concepts related to cardiac biomarkers. So the first question is going to be a 64 years old male with a recent anterior wall MI treated 3 days ago. See, every time I used to say that key points, find out the key points. So if the question is, it is like a paragraph, it is coming for 3 lines, 4 lines or 5 lines, doesn't matter. Just check for the key point. Okay. So once again, I will read the question. So just find out the key points. So 64 years old male with a recent anterior wall MI treated 3 days ago. That is the first key point. And present again with chest discomfort. Okay, means already the patient had MI. Again, the patient is getting, the second time the patient is getting the MI. The first time MI is treated already, and once again the patient is getting the MI. That is called as what? Reinfarction. The first one is myocardial infarction. First time it is already happened and treatment already done. Second time after 3 days, again the patient is getting reinfarction. So this is the main key point you should notice in this question. Okay. So ECG shows ST elevation. Definitely ST elevation will be there, and troponin I level elevated, remains elevated. Underline the word remains elevated. Okay. And CKMB is also increased. That is from 16 to 48 unit per liter in 6 hours. Okay, so past 6 hours CKMB is increasing from 16 to 48. 16 to 48 within 6 hours period it is increasing. Okay, so here one point clearly we understood that it is a reinfarction. That is the first key point. Reinfarction means second time the patient is getting the infarction, myocardial infarction. So that is the first key point. Second key point, troponin level is elevated. Definitely in the first attack, from the first attack itself, the troponin level remain elevated. It is not going to decrease until 10 days. Okay, 7 to 10 days it will remain elevated. Okay, so troponin level is elevated, and the second one, CKMB, is also elevated. That too in the past 6 hours, from 16 gradually the CKMB is increased up to what? 48 unit per liter. So these are all the key points you're supposed to remember while solving the questions. So what the exact question they are asking is, which lab parameter is most useful in confirming the reinfarction? So reinfarction we have to confirm. So how we are going to confirm, with which value we are going to confirm? So they have given 4 options like CKMB, troponin I, myoglobulin, and LDH, lactase dehydrogenase, that is called as LDH. Okay, so 4 options they have given. So among these 4 options, can you guess which is the right answer? So here the right answer is going to be what? Option A, that is CKMB. You can ask one question, sir. A myocardial infarction means immediately we have to think about troponin I, right? So that is for first time myocardial infarction. But here the problem is reinfarction. It is not a first time infarction. It is a reinfarction. In reinfarction, always we have to focus on CKMB. You should ask the question why. So the right answer, already I said that CKMB. The reason behind the CKMB is, you can see here. First, let's see why not troponin I. Why not troponin I? First, let's see the B option. See, troponin I stays elevated for 7 to 10 days. After the first attack, the troponin I remains stable for 7 to 10 days. If you take the blood sample and if you check the troponin I, In the first attack, it will be high. Even in the second attack, that is in reinfection, that time also it remains high. If you are checking after the 6th day, that time also it will be high. So for the first time attack, we can confirm that with the troponin I. First myocardial infarction, it is happening on the first day. The gold standard test what we supposed to do is troponin I. For the first attack, I am saying. First myocardial infarction the patient is experiencing means that time troponin I is the gold standard test. Please keep this in the mind. Okay. But if the patient is getting the reinfarction, so that time, if you are checking the troponin I, that time also it will be elevated. So we should not rely on troponin I for the second attack or third attack. So that time we have to go for the one more lab investigation, that is called as CKMB. You know, CKMB, once it comes out, for example, the patient is having, you can ask one more question, sir. In the first attack, CKMB is also elevated. Obviously, the first attack, CKMB is also elevated, but it will dissolve or vanishes from the blood within 3 days. Within 3 days, the CKMB will be vanishes out, but troponin I is not at all vanishing up to 10 days. So for reinfection, we should not consider the troponin I. We have to consider what CKMB because it is vanishes very fast within 3 days. In the second attack, again the CKMB after getting vanishing, again it will start coming out in the second attack or in the reinfection. That's why CKMB is the correct answer for reinfection. Clear, guys? Yes. So the right answer is going to be option A, that is CKMB. You can ask one more question also, sir. Why not myoglobin? Myoglobin, it rises very fastly and it is vanishes out within 24 hours. Within 24 hours, the peak of the myoglobin release will be around 12 hours. Okay, so we are not considering myoglobin as a standard golden marker for reinfection or even for the first attack. Okay, so for first attack, the gold standard test is troponin I, and for the reinfection, the gold standard test is CKMB. That's it. Okay, and LDH, that is lactase dehydrogenase. Previously, it is considered to identify late myocardial infarction. Underline the word late myocardial infarction. We used to identify with LDH, but nowadays it is not at all recommended. Nowadays, it is not at all recommended. Please keep this in mind. Okay, so these are all the important points. Let's add additional golden points, which is very much useful for your upcoming examinations. So these are all the golden points. So these are all mostly, memory based. Always I used to say to the students, memory based points you have to write in the separate register before the examination. 1 or 2 days before the examination, just go through it. It will be so much useful for you. Okay, for doing the revision. Okay, so comparison of the cardiac biomarkers, very important for your exams. Okay, so there are so many biomarkers like, troponin I, troponin T, CKMB, myoglobin and LDH, even BNP, that is B type natriuretic peptide. Okay, so these are all the biomarkers. So after the injury to the myocardium, at what time the biomarkers will be released? For example, troponin I, when it will release, when it will go in the peak, when it will dissolve or vanishes from the blood. Okay, so these things, so all these things, whatever I have mentioned here, these things are very, very, very important, memory based. Okay, so let's see what is this. Okay, so troponin I, when it will release, see, after the injury to the myocardium, within 3 to 6 hours, this troponin will be released and it will become in the peak within 12 to 24 hours and it will vanishes from the blood from 7 to 10 days. Okay, so it will stay for the long period of time. That's why for reinfection, we should not consider the troponin I. For first infection, we have to consider it as a gold standard test. Okay, for a first myocardial infarction, we have to consider it as a gold standard test. Okay, second one, CKMB, it is a gold standard test for what? Reinfarction. Okay, so it releases within 3 to 12 hours and it will become peak in 24 hours and it will vanishes from the blood within 3 days, that is 72 hours. And myoglobin, it is the earliest marker which is coming in the blood after the injury to the myocardium, that is it will release within 1 to 2 hours. The peak will be 6 to 9 hours and 24 hours. Within 24 hours, it will vanishes. So LDH, as I mentioned already, previously it is used to identify the late myocardial infarction, but nowadays they are not using it. And B type natriuretic peptide, it is very, very important. Previously related to troponin I, CKMB, myoglobin, BNP. Many times the question asked in the exams. Many times means many times. Okay, so BNP and NT-proBNP, I will discuss separately about the difference between BNP and NT-proBNP. Okay, so these two things are very much important to identify the heart failure. Okay, fine guys. So this BNP, it is released from the ventricles of the heart. Okay, and whenever the heart is failed, especially the ventricles are affected, that time the BNP and NT-proBNP will be increased. Okay, fine. So the next important points are, yes, the normal range. So again, this is a memory based things. Please write it in the separate register. Okay, the normal value of troponin I and all the cardiac biomarkers are very important to solve the questions. If you don't know the values, then how come you solve the questions? Okay, so troponin I, the normal value is less than 0.04 nanogram. Troponin T, it is less than 0.01 nanogram. CKMB, it is less than 5 nanogram. Please remember this. Myoglobin less than 90 nanogram. BNP, that is B type natriuretic peptide, which is secreted from the ventricles of the heart. Here it is less than 100 picograms per ml. And NT-proBNP, it is less than 125 picogram per ml for the age of less than 75. Okay, so all these normal values are very important to solve the questions, guys. Okay, fine. So let's see in detail about the next question. So the next question is, so in the previous question, we have discussed about the troponin, CKMB. Okay, so these two parts we have covered. So that is the first concept. The second concept, we are going to discuss about BNP, B type natriuretic peptide in detail. Let's start that with the MCQ question. Okay, fine. So a 59-year-old woman with the history of hypertension present with acute shortness of the breath. This is the first key point you're supposed to remember. There is no chest pain. No chest pain at all, and there is no fever. Okay, but the chest x-ray shows bilateral haziness. Haziness means cloudy like patches which is present in the x-ray. Okay, if you are seeing the lungs of the patient in the x-ray, cloudy like patches are present. That is called as what? Bilateral haziness. So here the key point is shortness of breath is there. Shortness of breath can be come in two indications, in two problems. That is, if the patient is suffering from pulmonary problem, the patient will be getting shortness of breath. If the patient is getting cardiac related problem, that time also shortness of breath will be there. Okay, so it is like a differential diagnosis. So we need to find out where is the exact problem, whether the person is suffering from pulmonary disease or in the cardiovascular disease. Okay, fine. So let's find out how we are going to see. See, here they have given one clue for us, that is B type natriuretic peptide. The level is 1450 picogram per ml, heavily high. One key point, let me tell to you, if the BNP is more than 500 picogram per ml, directly you have to go with the problem which is related to the heart, like heart failure. Always BNP we are used to check for the heart failure patient. Okay, see here the patient is having shortness of breath, that is differential diagnosis, but there is no chest pain. There is no chest pain at all, no fever, but the chest x-ray shows there is some cloudiness, pulmonary edema is present, that's why cloudiness. And very confidently the BNP report shows as 1450 picogram per ml. That is B type natriuretic peptide level is severely elevated. Severely means severely, because the normal value in the previous slide we have discussed, BNP, the normal value is less than 100. Less than 100. But here the normal value, it is exceeded 2450 picograms per ml. So in that case, the key point what I'm saying to you is, whenever you are seeing in the question paper BNP is more than 500, it shows the patient is suffering from heart failure. Shows that patient is suffering from heart failure. Because of the heart failure, the patient is suffering from what? Acute shortness of breath. Clear? So here what is going to be the answer? What do the lab findings most likely indicate? Lab findings. What lab findings most likely indicate? Lab finding is nothing but BNP. Okay, so it indicates the right answer is going to be what? Acute pulmonary failure. Clear, guys? Yes, fine. Let's see the answer here. Already I have said the answer. The correct answer is going to be acute heart failure because the BNP is elevated very severely. Okay, fine. So let's see the rationales. The first option, pulmonary embolism, is incorrect. See, pulmonary embolism may cause BNP, but the value will not be increased like this. Okay, may rise the BNP. Pulmonary embolism, if the patient is suffering from pulmonary embolism, because of the pulmonary embolism, if the ventricles are affected, that time BNP will be elevated. B-type natriuretic peptide can be elevated, but it will not be more than 500. Make note of it. It will not be more than 500. Because of pulmonary edema, if the BNP is elevated, but it should not be more than 500. Okay, but here it is more than 1000. So directly you can blindly tick acute heart failure. Okay, so here the correct answer is because of more than 1000, we are going with what? Option B, that is acute heart failure. Okay, and the third option, pneumonia. Pneumonia, it will not increase the BNP. Okay, so just eliminate it. ERDS also will not increase the BNP. So eliminate this option also. Okay, guys, fine. So here on the whole, the right answer is going to be what? Option B, that is acute heart failure. Okay, fine. So additional key point which is related to BNP, guys, please make a note of it. Again, very important slide. So BNP, what is BNP? First, you should understand that concept. Okay, so BNP is nothing but it is a hormone. What is that? It is a hormone. You can see here, it is a hormone which is secreted by the ventricles of the heart. Okay, whenever the heart pressure is increased or volume of the heart, especially in the ventricle, it is overloaded. Okay, the heart is overloaded because of congestive heart failure. So that time what will happen, the ventricles will release a hormone that is called as what? B-type natriuretic peptide. Please remember this. Ventricles will release B-type natriuretic peptide. Atrium is not having any role in BNP. Okay, let's see the normal values. Already we have seen the normal values of BNP. See, BNP, the normal value is less than 100. Okay, and NT-proBNP, the normal value is less than 300 under the age of 75. This NT-proBNP, it will change. The value will be changed according to the age. Okay, see, one more additional point, let me tell you here. See, BNP and NT-proBNP both are hormones which is secreted from the ventricles, but the active hormone is BNP and inactive hormone is NT-proBNP. But in case of heart failure, BNP and NT-proBNP both will be elevated. Both will be elevated. Clear, guys? Yes? Fine. So when the BNP will be elevated, what are all the conditions the BNP will be elevated? You can see here very clearly in case of heart failure, that is in acute as well as in chronic, the BNP level will be elevated. The next one is pulmonary embolism. Because of the pulmonary embolism, if the ventricles are affected, that time BNP will be elevated. Because of the sepsis, if the heart is affected, BNP will be elevated. And BNP is usually excreted in the kidney, through the kidney. Okay, if the problem is existing in the kidney, the BNP is not at all excreting out. That time, the BNP level will be elevated. Okay, so on the whole, these four conditions will cause what? Increase in the BNP level. Okay, but the specific marker for identifying the heart failure is BNP, B-type natriuretic peptide. Okay, guys. Fine. So one more additional golden points. I would like to compare the BNP and NT-proBNP. Recently, there was a question which is asked related to NT-proBNP. So I would like to compare BNP and NT-proBNP. So listen carefully, guys. See, let's see the full form. For BNP, the full form is B-type natriuretic peptide. You all know that. And NT-proBNP, the full form is N-terminal pro-B-type natriuretic peptide. Okay, so already this point, second point already I have mentioned, it is an active form. Which one? BNP is an active form and NT-proBNP is an inactive form. The main important point I'm going to discuss now, that is BNP, the half-life is only 20 minutes. Only 20 minutes, whereas in NT-proBNP, the half-life is 60 to 120 minutes, almost 2 hours. Okay, suppose if the BNP level is not elevated, for example, you are suspecting the patient is having heart failure. So you are withdrawing the sample for BNP, for checking the BNP, but the BNP level is normal because the half-life is only 20 minutes. After that, it will dissolve. After that, it will vanishes out. Okay, so the second option what we can check is NT-proBNP, N-terminal pro B-type natriuretic peptide, because here the half-life period is extended, that is up to 2 hours, up to 120 minutes. Okay, so this is the first preference we are giving. If we cannot identify the BNP, then you can go with what? NT-proBNP. Okay, fine. So both the things, BNP and NT-proBNP, are used to find out what? Heart failure. Clear, guys? Yes, fine. So next question is a 60-year-old male. So in the second concept is also over. That is, the second concept is all about BNP, B type natriuretic peptide. Okay, so now we are going to start with the third concept. Let's see what is that. So the question here is, a 60-year-old male with a mechanical mitral valve replacement is on warfarin therapy. Two key point: mitral valve replacement done, and now the patient is on warfarin therapy. What therapy? Warfarin therapy. He present with hematuria. Third key point. Warfarin therapy is going on, but unfortunately hematuria happened. Internal bleeding happened. That's why hematuria is going on. So warfarin and hematuria both are linked together. If the patient is continuously taking warfarin, more and more bleeding will be there. More and more hematuria will be there. Right? So what we supposed to do now? Fine. So let's see the values of the lab. INR is 6.2, heavily increased. Okay, heavily. The normal INR should be 0.8 to 1.2. In case of mitral valve replacement patient, it should be 2.5 to 3.5. That is a normal INR therapeutic range for mitral valve replacement. But here you can see the INR is extremely high, 6.2. And PT level also prolonged. The normal PT is 10 to 13. But here it is increased. APTT is normal, platelet is also okay, but INR and PT is abnormal. So here the question is, what is the most appropriate action regarding this lab findings? Okay, warfarin therapy is going on, hematuria is also going on. What we supposed to do now immediately? The options are administer vitamin K, start low molecular heparin weight, heparin, continue warfarin. As a therapeutic range is 6 to 7. So in the third point, they are saying that 6 to 7 INR is normal. Give aspirin to prevent the thromboembolism. Warfarin is going on for the patient. Same time, internal bleeding is happening. Hematuria is going on. What we supposed to do now? This is the question. So here the right answer is going to be, we have to arrest the bleeding and stop the warfarin. Otherwise, the patient will go for what? Shock. Okay. So in order to avoid that, what we supposed to do? We have to stop the warfarin and we have to administer vitamin K. What we supposed to administer? We have to administer what? Vitamin K. So the right answer is going to be option A, administer vitamin K. Why? See, the INR is more than 6, means severe bleeding is going on. So whenever the patient is having INR more than 5, immediately we have to start with what? Vitamin K. Because the vitamin K will reverse the warfarin effect. Okay, guys. Yes. So here the right answer is going to be option A. Why not other option? See, already the patient is having bleeding. That time, if you are giving the low molecular weight heparin, means the bleeding will increase. So just eliminate the second option. Okay. Continue warfarin. Why? How we can continue the warfarin? The patient is already suffering from severe bleeding. We should not continue the warfarin. So third option also we can eliminate. Aspirin to prevent thromboembolism. Aspirin will also increases the bleeding tendency. So eliminate the aspirin also. Okay. So on the whole, the right answer is going to be what? Option A, that is administer vitamin K. Okay. Fine. So let's go for the next option. Next question. So here on the whole, what the third concept it covers is, it is related to what? INR and warfarin therapy. Okay, so the three concepts are over, and the fourth concept, okay, few more important points related to INR. See, most of the student doesn't know the full form of INR, you know. So INR, the full form is International Normalized Ratio. INR means internationalized normalized ratio. So the normal value is 0.8 to 1.2. Very important. INR normal value you should know to solve the question, guys. Okay, so normal values as well as therapeutic value, both you supposed to do. The normal value is 0.8 to 1.2, and the therapeutic INR ranges. If the patient is taking warfarin, that time we used to say it as what? Therapeutic INR ranges. It changes according to the problems. For example, if the patient is suffering from atrial fibrillation, deep vein thrombosis, pulmonary embolism, that time if the patient is taking warfarin therapy, means that time the INR level should be 2 to 3 is acceptable. 2 to 3 is acceptable. If the patient is having mitral valve replacement, it is related to the question. patient is having mitral valve replacement and the patient is on warfarin therapy, that time INR 2.5 to 3.5 is acceptable. The last one is aortic valve replacement. Here the patient is taking warfarin. Here the INR, how much is acceptable? 2 to 3 is acceptable. Okay, and one more additional point, whenever you are seeing any question which shows that INR, it shows higher chances of bleeding. Higher chances of what? Bleeding. Whenever you are getting low INR, higher chances of clotting. Okay, so these are all the key point always you're supposed to remember, guys. Okay, fine. Let's go with the last question. The fourth concept, three concept is over. The fourth concept, your 45-year-old woman arrives in the emergency department with sudden onset of shortness of breath. First key point. Chest pain on the deep breathing. Obviously, chest pain is also there. Shortness of breath is also there. She has been on bed rest for the past 10 days after the leg fracture. Her vitals or heart rate is 110, saturation 90, on room air, BP is okay. The doctor suspect a pulmonary embolism. So the doctor is suspecting what? Pulmonary embolism. This is the first key point. Order D-dimer test. This is the second key point. And the D-dimer test result shows that it is 1.8 microgram per ml. D-dimer, it is the doctor is suspecting pulmonary embolism, so the doctor is advising the patient to do D-dimer test, and the value is 1.8 microgram per ml. I have added the normal value also. The normal value of D-dimer test is less than 0.5, but here you can see more than 0.5, that is 1.8 microgram per ml is there. So it shows that the patient is suffering from. What does the elevated D-dimer result suggest? So this is the question. So once again, I will repeat, listen carefully. See, from here to here, no need to bother about anything, guys. There is no key point here. Okay. But here the doctor suspect the pulmonary embolism. This is the first key point, and order the D-dimer test, and the value of the D-dimer test, that is 1.8 microgram per ml. This is the second key point. Okay, with these two key points, we can solve this question very easily. Okay, I have added the normal value of D-dimer also, less than 0.5 microgram per ml. Here it is 1.8. It shows it is higher level. Whenever there is a severe clot formation and more fibrin debris are present in the blood, that time you can see what? Elevated D-dimer. Okay, it means patient is suffering from heavy bleeding tendencies. Okay, so the question is, what does the elevated D-dimer result suggest? So this is the question. So four options they have given here: confirm pulmonary embolism in the present, suggest blood clot is possible and imaging is needed, indicate heart attack has occurred, is normal in patient after trauma. So four options they have given. In which condition the D-dimer level will be elevated? So that is the question, and four options they have given. So let's see the right answer. So the right answer is what? Most of the students used to say that the right answer is going to be confirms pulmonary embolisms. But that is the wrong answer. D-dimer is not a confirmatory test, guys. D-dimer is not a confirmatory test. Okay. So the D-dimer test says that there is some blood clot in the body. Okay. So after the D-dimer level is elevated, it is confirming that there are so many blood clots which is present inside the body. So the doctor will think about CT pulmonary angiography. CT pulmonary angiography. So CT pulmonary angiography is the confirmatory test. After doing CT pulmonary angiography only, the doctor will confirm that the patient is suffering from pulmonary embolism or not. Okay. So D-dimer is not a confirmatory test for pulmonary embolism. Please remember that. Okay. So that's why I eliminated the option A. Okay. So the right answer is going to be option B. That is, D-dimer elevated means it suggests the blood clot is present, and second, CT pulmonary angiography has to be done. After doing the CT pulmonary angiography only, we can confirm that the patient is suffering from pulmonary embolism or not. Okay, so it indicates heart attack. No, it has no role in heart attack. It is normal patient after trauma. See, D-dimer will be elevated in so many conditions like, after the surgery, after the trauma, for during the pregnancy, D-dimer level will be elevated. And even the pulmonary embolism, deep vein thrombosis, all these conditions also D-dimer level will be elevated. Okay, fine. So that's why for confirming the problem, what we supposed to do, we have to do imaging test like CT, pulmonary angiography. You can see in the rationale also, everything is clearly mentioned. See, the first one is incorrect because we cannot confirm pulmonary embolism with D-dimer. Second one is correct. The D-dimer says that there is a clot. After confirming there is a clot in the body, you have to go with the imaging like CT pulmonary angiogram. Okay. And third one, D-dimer is not a specific test for heart attack, so we can eliminate the option C. And after trauma, after surgery, D-dimer may be elevated. This is the normal one, so you can eliminate this one also because the option B is directly connected with the question. Okay. So in this session, we have discussed 4 important concepts, that is, troponin I, CKMB, both together we have discussed. After that, B-type natriuretic peptide, INR, that is internationalized normalized ratio, and the last one what we have discussed is which one? D-dimer. Okay, so all these concepts are very, very, very important. So many times from here they have asked questions in the exams. If you have any doubts anywhere related to these concepts, you can drop your message in the chat box or in the comment section. Okay, and if you like the video, please like it, share it, and subscribe the channel, guys. And all the best for your upcoming examination. Thank you very much.